not only does that mean that you're now immune, but your immune system, because of this learning process that's taken place, is now going to respond really, really fast. So if you get infected much later, you might not notice it, or it might be fairly mild, because the immune system is poised to recognize any antigen that it's been exposed to before. And that's really nice. Now, this is just re-emphasizing the point I've just made, which is that the memory B cells, and also the memory T cells that we've not talked about, don't need as much antigen to be activated as they were before, so they'll detect the infection much earlier. And also, as we'll see, the receptors that they express will usually have higher affinity for the antigen than the original cells did. So the immune system has got better and quicker at recognizing that particular infecting agent. Now, some agents get around this, of course. Already talked about flu, that shuffles its, keeps on changing its cell surface, which is why we have to keep on producing new vaccines year after year. Malaria is another classic example, which is very good at reorganizing its cell surface. That's why it used to be called relapsing fever, because if you'd got a malaria infection, you actually carry the parasites forever. They would come out, you get a high fever, your immune system would cope with them, they'd go back into the cells where they hide, they'd evolve a little bit and then pop out again, and then your immune system would have to learn all over again to cope with them. So it doesn't work against all diseases, but you can be very thankful that you've got an immune system, because you certainly wouldn't be alive if you didn't. So I'll say more about the origin of antibody diversity later on, where that initial diversity comes from in that first differentiation state. I want to say something more, a bit more, and I'll say more about the B-cell maturation process as well. Let me just wrap up. I think we'll just make a couple more points about vaccination, and we'll wrap up for today. So the idea about vaccination classically came from the observation made by Jenner, who's this guy here, that milkmaids, by and large, didn't get smallpox. And I'm sure most of you know this story. Smallpox, of course, used to be a really major disease in the UK as elsewhere. And even if people recovered from it, which they often did, they would be scarred for life, and the scarring from smallpox is quite severe. And Jenner noticed that milkmaids, women that used to milk cows, which there were quite a lot in those days, didn't appear to get smallpox, although they did get a disease which was called cowpox, which was kind of like smallpox light. They got an infection that scabbed up in the way that smallpox does, but it was nothing like as serious. And he got the idea that maybe cowpox and smallpox were related in some way, and that people who'd been exposed to cowpox then didn't get smallpox. And he didn't, of course, know anything at all about the immune system. This is back in the 18th century. But it was quite a leap to make. So he did an experiment that would absolutely under no circumstances be permitted today, which is he got some material from a woman who was infected with cowpox and infected a young boy with the cowpox, and the boy then developed cowpox, and then tried to infect him with smallpox. And lucky for Jenner, and particularly lucky for the young boy, this process actually worked, and the boy was now immune to smallpox. Also, you wouldn't be able to do that sort of thing today. I don't know if you might have seen this famous illustration by a cartoonist. This is meant to be Jenner, and he's inoculating people with cowpox. And the idea of vaccination didn't go down at all well. People thought they were going to kind of turn into cows, or have little cows coming out of their mouths or growing out of their noses or whatever. And so there's he had to work pretty hard to persuade people to take this on as a genuine medical cure. And it has to be said that vaccination still has its opponents around the world who think it's a bad thing and it causes more diseases than it cures. That is absolute nonsense. As I said, next to clean drinking water, vaccination has probably saved more lives than anything else in human history. Antibiotics in there as well, but by the time antibiotics came along, a lot of the bacterial diseases, and certainly the viral diseases, which can't be dealt with antibiotics, had successfully been dealt with. And there are occasions where vaccination programs falter or are incomplete. The only example of a disease that's been completely eliminated through vaccination to date, of course, is smallpox, although there's potential with quite a few others. This link is taken from Pakistan, where there's been a campaign against vaccination led by the Taliban, and so people doing vaccinations, this is against polio, have to be protected by armed guards. Quite a few of the health workers doing vaccinations have actually been murdered because they're thought to be infecting people with AIDS or something like that. So it's a pretty noble thing to be a health worker in a country where you can be shot just for vaccinating a child. And then you'll see things like this. You don't have to go very far on the internet to find that there's no such thing as a safe vaccine, that there's all sorts of diseases, autism and diabetes and meningitis. People have looked at this really, really carefully. There have been massive studies done with hundreds of thousands of people, and there is just no evidence. It's not to say that there aren't adverse reactions to vaccination. Probably some of you have had a vaccine that's made your arm really stiff for a couple of days or given you what feels like a nasty dose of flu. Generally speaking, much preferable to the diseases that you would be getting if you hadn't been vaccinated. Polio is well on the way to being dealt with, so it's a long time since the case of polio has been reported. I have a connection with this. My father had polio when he was in the military in the war, and all his life walked rather badly as a consequence, and it actually re-emerged in late life, and he was in the wheelchair for the last few years of his life. So in my family, I actually know what it's like to have polio around. It's now extremely rare in most countries, and I think probably if things carry on, it will go the way of smallpox. There won't be anyone suffering from that disease any longer. Obviously, getting rid of one disease does make space for others. People who work very hard to come up with an effective vaccine against HIV, not successfully so far, although Ebola, which broke out a couple of years ago, now does have quite a strong vaccine against it. So sometimes it's the case that vaccines these days, now that we know what's going on, can be developed very quickly indeed. So vaccination is essentially just pre-exposing the immune system to something that would cause the disease, but without actually causing the disease itself. The early vaccines, of course, were extremely crude. You would get the disease or something that was pretty much like the disease. Now that we understand a great deal more about the structure of viruses and the sorts of things that cause disease, we can isolate components of those and make the vaccines out of those without having to have the parts present which are responsible for causing the disease itself. So there's lots of things that we can vaccinate against, some bacterial, some viral. There's some of the examples. Diphtheria, incidentally, there's quite a nasty outbreak happening in the world at the moment, I think because the vaccination programs there haven't been working too well. The childhood diseases down the bottom is still somewhat controversial. Most of these things, most kids now get the triple vaccine, which is measles, mumps and rubella, pretty shortly after birth. But there's still quite a few that we don't have good vaccines against. I mentioned HIV. Malaria is extremely hard to deal with because of the way that the organism shuffles its cell surface antigens. TB, there are vaccines against, but they're not that great, and they don't work particularly well against a lot of the worst strains. So TB is a major problem. I've put Ebola down here because that slide was made a couple of years ago. That's no longer true. There is quite a good vaccine against Ebola now. Bilharzia, sleeping sickness. You'll notice that quite a few of these are diseases that are perhaps associated more with developing countries than the developed countries. And obviously one of the issues here is the economics of this, that these are expensive drugs to develop, and the countries that produce most of the drugs, until relatively recently, have not been the ones where these diseases have been endemic. That's a situation that is now changing. And they affect very large numbers of people. During the course of this lecture, probably a dozen or so people have died of HIV and another dozen have died of TB. So these still are major causes of morbidity worldwide. Okay, I think I'm going to wrap up at that point. We'll carry on with a little bit about vaccination next time and then get back to antibody structure and function and monoclonal antibodies. So we'll stop there for today. So I assume everyone's signed the register. That's good. I'll see you all next time.